This is a short video on the research review of the meta-analysis of the TUV reviewed and accepted clinical evaluation of the Eductor. We're going to be talking about the Eductor as the validated and verified form of energetic medicine that has saved energetic medicine around the world. First, we need to understand that the body is made of atoms, and in the outer part of atoms are electrons. These electrons repel each other, thereby no atom touches another atom. In fact, the distance between these atoms is quite great, as what we are is an electrical field that holds these atoms together through energetic processes. Well, then why don't we develop a medical device that actually measures the body electric and then treats the body electric? Why don't we just realize we need to go beyond the chemistry and into the energies of the body? Well, this is what we've done with the Eductor. And we need them to understand that there is a desperate need for validation. You need to put your money where your mouth is. You need to be able to do the research and develop it. And I'm going to be talking about a vast amount of research that has been over 30 years in a description of how we got to validate the Eductor. Now, we want to start with the idea of what happened in 1957 and how that led to me being involved with the Apollo program and being able to help the Apollo astronauts back, as I was working with the Apollo system in Apollo 11, 12, and 13, as working with AC electronics. Now, at Youngstown State University in 1973 and 74, we made a very unique study. We were able to show that the body electric can communicate with another body electric, not through the words, but not through the vision, but through the body electrical fields, and that there was a way that things could get together. And this was back done there in 1973. Then we started looking into many other different paths of evidence, the entire, what we call a meta-analysis. And we really started getting involved with the subjects back at the AAQBT, where we were able to take 935 different subjects. With the proper IRB and all the different legalities satisfied, we were able to then find a way to get the base idea of the body electric and many different factors. This led, of course, to the FDA registration in 1989 of the EPFX system, which is now known as the Eductor. It's still legal today and always has been since the first day of inception. Now, we're looking at some of the different studies, and here we are showing you now some of the different types of certifications from all around the world, different countries that have certified the device as safe and effective. In China, the registration is as a diagnostic device. And basically around the world is done as biofeedback, but biofeedback is different in many different ways. See, validation, verification, these different studies are very important. And then we get to these claims that have been medically determined as the base of the system. Then in England, way back in the early 90s, we had a published study about the device, and we did a Camelford water pollution program that was very similar to what we found much later in a Hungarian system. 1992, we had a presentation at the Royal Society of Medicine, London, England, where a group of doctors presented their ideas on energetic medicine and our technology, hallmarking and establishing what we've done. I worked with Dr. Albert St. Georgi, who won the Nobel Prize for vitamin C. I worked with Hans Selye for his ideas in stress. And we were able to develop a system of stress analysis and analyzing the body electric. Then we were able to look into the facts of electroceuticals. Through a voltammetric process, an electronic tongue, a QQC electronic tongue, the voltammetry was allowing us to measure the electrical field of different items, and then feed that electrical field into the patient and get an established loop of what we now know as transcutaneous voltammetric evoked potential, TVEP, and lots of studies that were able to show us how this works and how well it works and how we could use this to measure the reactivity of our patients to different substances, all properly validated and verified, of course. So now, the next big step was developing a large-scale study where over 2,200 medically trained therapists, medically supervised, evaluated the results on over 100,000 patients. over 350,000 patient visits. And this was the next step on our pathway to evidence, our meta-analysis. A large study that was able to prove safety and prove effectiveness. This large-scale study showed that in over 220 different diseases, how our device was safe and effective. The type of validation and verification that is needed by law. Then in 2006, visiting AC Milan, we did studies. We were able to show that we could help them reduce their injury rate. We helped them to win the Italian and European League. But we could increase the healing effects of the body and help these players to win. In 2008, we did the study with the Chinese and working with them, and incredible results. And I must encourage you to watch the Adam Mendel videos and see what he did. It was absolutely astounding. Because, as Adam would tell us, you take an athlete, throw on the skio, which now we call the Eductor, and you're going to get gold. Then we did Project Nakinga, working in South Africa to work on ideas of AIDS. I worked with Novak Djokovic and helped to turn his career around into this incredible athlete that he's been. And right when I started working with him, he was able to find and discover the power. We've worked with all kinds of different athletes. And the stories are amazing, and you should dig into the research to understand this more. Because as we measure the VARHO, voltage, amperage, resistance, hydration, oxygen potential, we can measure the body electric and recharge your batteries. And recharge your batteries and make you a little bit stronger, a little faster, a little smarter. The electroceuticals being able to work into the process. And the GSR increases sports performance, as we've shown in many different studies. Validated, verified, helping to increase the intelligence, increase the insight. Incredible work for school enhancement, sport enhancement, life enhancement. And through the science, we're able to show this incredible effect of being able to help your child be a little smarter, a little stronger, a little faster. Then we did a large study in Bucharest at the Medical Institute, and all of our studies completely done by independent medical doctors. And then by using the cybermagnetic chair to magnetically send energy into the body, we did a whole new set of studies that by now we could bring music into the system and increase the feedback loop, because we would be able to go beyond just the electron feedback loop to a magnetic feedback loop, sending energy into the body, feeding the results, and then altering through an autofocused, automatically adjusting process. All done and published in peer-reviewed medical journals to validate and verify these type of claims in the system. And we've been able to show that we can even help increase so-called superpowers, ESP, psychic communication, going back to the 1973 study. Here's an excerpt from a 1977 movie that dramatizes basically a type of research that we were doing, because we used strobe lights and we used a brainwave device as well as EKG and GSR to measure the body electric, and we were able to show that there was an electrical transfer from body electric to body electric beyond just wires, etc., what we call a subspace. And we did this in 1973 at YSU, and we could show this transfer of information. But it was nonverbal. It was never verbally recognized. It wasn't really in the way of pictures or words, but there was a body electric connection that could be established. And now today, science has fully accepted that two things, once connected, can maintain communication. It's the principle known as quantum entanglement. And we've now reproduced this work that we started in 1973, and with the Eductor, we were able to do it again, validate, verify. And now we move into doing work with animals. We're doing work with veterinarians, all part of this large meta-analysis. If you read the books and read the studies and read our clinical evaluation, you'll be amazed at what we've been able to do, starting way back when, 1973, and then going on to a large study, then phase 2, an extremely large study, and now phase 3, much more equipment, much more work. The sport history, Nobel Prize presentation, Chinese Olympics, all to establish and validate the claims, the medical claims, validated, verified. Because you see, we can make your child a little bit stronger, a little bit faster, a little bit more coordinated. And the cost of doing this type of validation is extreme. But we've spent all this time and all this money to bring to you this incredible system that you can go on the World Health Product Rating System and you can find out about our rating. You can compare other different devices. And you will see that with the cybermagnetic loop, sending energy into the body, autofocusing, and sending it back. Validated, verified evidence, along with the QQC trivector, to be able to bring this all to you, bring this to you. And the Immune and the Medical Library can offer you all of the validation verification. I welcome you to look into more and to ask your questions so I can help you more. This is Desiree Dubonnet.